One of the most important concepts of upper cervical care is the concept of holding your correction. Now, within the profession, some people still refer to it as an adjustment, but correction is a more accurate term because that's what we're going for here. A correction that holds, not something that needs to be adjusted over and over again.
It's holding the adjustment that gets people better. It's not adjusting them. It's keeping the interference checked out over a period of time that allows people to heal and repair back to normal state of health.
I talk about holding is healing. When you're holding your adjustment, that's when you're working at your best. Your body is able to function optimally. Chemical insults, including medications, alcohol, smoking, stress, those can make it so that you don't hold your adjustments as well. They weaken the ligaments that hold the body, hold the bones together.
Each time I check a patient, I'm looking to see if that body is in a healing pattern in terms of balance. Are the muscles of the spine balanced? Is there head-neck distortion? Is there locking in the mechanics of the spine? Is there leg length discrepancy? Is there articular pillar pain or tenderness? When all of those are checking clear, that body is in a healing pattern and you need to allow it to continue to heal and only adjust when it's pulling out a pattern and needing that assistance to continue to heal.
Within 2 months, 25 different symptoms that she had were almost completely gone. She held the first correction for 6 months. That's the power of upper cervical chiropractic. It is not adjusting, it's holding. I didn't heal her. All I did was put the bone back under the body's control, cleared the neurocanal, and innate intelligence, that inborn wisdom that flows from above down, from the inside out, restored her back to health.
On each of her follow-up visits, he would help her maintain that alignment correction so there's no interference in the healing process until it was complete.
How long will it take a patient to get better on upper cervical care is a very tricky question because it really depends on multitudes of different factors. You know, how old the patient is once they come into an office, how long the problem's been there, what degree of damage we see on an x-ray. So really it encompasses many different factors. So we can see people get immediate symptomatic relief or problem relief right after a correction, and sometimes it might take months or years to the body to completely resolve itself of a health condition. And it also depends on what your lifestyle factors are like. Maybe, you know, if you're a smoker, or if you have any kind of emotional stress or physical stress, maybe you have a demanding job. And so a lot of those factors take into play, and really when it comes down to is that you have to know what it takes in all aspects of your life to regain health. 25%
of the patients we adjust within the first week, they have what I call the wow experience. Wow. If I had known about this 20 years ago, I would have been here 20 years ago. The other percentage of patients, they slowly start to come out of their problems. And that makes sense. If you've been suffering, had tissue damage and inflammation and ligament damage and all sorts of problems, it's not going to happen overnight.
But it took 5 years to completely correct that neurological situation. I've seen many younger patients and patients who have not had those problems as significantly as she has heal up much faster.
Now, for instance, for a small child that's only had a misalignment a few days or a few weeks or a couple years, obviously can recover quicker than someone that's had a misalignment for 30 or 40 years.
How long you've had your subluxation plays a major role. If you were dropped on the floor or fell off the changing table at age 1, and came in to see me at age 30, 30-year-old patient's pretty young, but they have a 29-year-old subluxation. And the problem that they're going to have is their muscles will have amnesia. They've lost their memory. So they do not know how to pull themselves back in place. So you might think the #1 objective I have is to get rid of your pain and get rid of your symptoms. And fortunately with upper cervical, that's usually the first thing to go away. But what I'm really concerned about is getting the memory back in those muscles and ligaments so that they can start pulling the segment back in on their own. I don't want to follow you around the rest of your life when you go to Yosemite, well, maybe when you go to Yosemite, Hawaii. But what I'd rather do is have that spine regain its memory it's supposed to have and learn how to fix itself.
Well, after your first correction, you may experience some soreness due to the body being out of balance for so long, and the body's trying to get back in balance. There's a lot of muscles and stuff that have been out of place, and as they start to restructure, there's toxins that build up in the muscles. So the muscles have to get rid of those toxins, and that's why you could be sore. So we encourage patients to drink tons of water so that doesn't happen. Another thing is patients may not experience anything at all. That doesn't mean it's necessarily a good thing or necessarily a bad thing. It just may take time for that body to heal. And then the third thing, some people may experience relief. You know, as patients come in, they may have a headache, we do an alignment, and then the headache could go away, for example.
Patients will come to us and say, you know what, I'm no longer having bladder issues, and we never knew they had bladder issues. You know, the body just starts to heal itself. We don't know what it could possibly be helping.
Within minutes, some things started to happen, positive things. It was almost like my whole feet started to warm up.
When she turned that switch on and opened that up, so that brain stem that's set right in the center of those two, when she opened that up, the first thing my brain stem did is it heard and felt this pain. And I'm sure it said, "What are you doing?" And my jaw went, "I'm pouring it on." And my brain said, "Stop that." And it stopped.
That was the only adjustment I ever gave her. She made it a miraculous recovery. Lived 15 years after that. Friends and neighbors called it a miracle.
To better understand how upper cervical care works, you really got to understand all the players involved in the system, your body parts and how your body functions. We've got the top two bones at the top of your spine, the atlas and the axis. Your nerve system flows through those top two bones. And your nerve system is like the superhighway of communication throughout your entire body. And where is that communication coming from and going to? That's right, your brain.
Sometimes patients really have a hard time grasping upper cervical because it makes too much sense. They ask me, could it really be that simple? And yeah, actually it is. It's as simple as stepping on a garden hose. Let's say, for example, you have a garden hose connected to a water spout, okay? Turn that garden hose on, water's flowing freely. Well, you come over, you put your foot on that garden hose. Now what's going to happen to the water coming out the hose? Well, obviously it's going to be diminished, possibly even cut off altogether. Well, the same thing happens with your body.
I think that most people recognize that the world's greatest drugstore is within your own body. It knows how much cortisone to produce and how much antihistamine to produce. It even knows how much cholesterol to produce, provided the system that regulates that is able to do so.
You have to deal with that life power and respect it and work with it. Don't fight with it. Let it have its way. You can do that when you get rid of the cause of the interruption between the source and the body by correcting the upper cervical vertebral subluxation.
So if the brain can't communicate with some part of the body, it's going to get sick. But if the brain can communicate with all parts of the body, we stay well.
That's the simplicity of it. That's the simplicity of it. And people can't, you can give them the garden hose analogy that there's a source for the water, and you step on the hose and the water doesn't water the grass, and when you remove your foot from the hose, the water comes out and waters the grass and the grass grows. And it's too simple for them. It's just too simple. There's got to be something more to that. We've got to spray something on the grass. We've got to add something to the ground to make it grow. We've got to intervene in that. And the wonderful thing about the body and the complexity of it is that it's intelligent in itself. It's a self-healing organism. It just doesn't need any interference to its function. And all we do is correct that, and we can expect health.
Unfortunately, upper cervical care is still the best kept secret in healthcare, and we're trying to change that. These videos are a part of that change. UpperCervicalCare.com is doing its part as well. But to fully understand why upper cervical care hasn't fully infiltrated society, you've got to understand its history.
In 1893, a man by the name of Daniel David Palmer, went by the name D.D. Palmer, he was working in his office one night, and he had a janitor there that was telling him about how he lost his hearing like 17 years ago. And what happened was he heard a little pop sound up in his neck, and then all of a sudden his hearing went away. Well, Dee Dee said, well, let's take a look at your neck and see if maybe we can figure out what happened to make you lose your hearing. So when he started feeling around his neck, he felt a little lump, and what happened was he pushed on that lump and made a popping sound. Well, at first nothing happened. So he did it 3 days in a row and pushed on that lump and popped that neck, and boom, his hearing came back all of a sudden. So Dee Dee Palmer said, I've got the cure for all deaf people. Dee Dee had people coming from all over the world with deafness. Well, not all the deaf people got their hearing back, but what he found was that a lot of other conditions started clearing up. People had kidney problems that cleared up and heart conditions and stuff like that. So then his son comes into the picture, B.J. Palmer, who is known as the developer of chiropractic, because he took what Dee Dee was doing, which was basically pushing up and down 3 times on each side of the spine, any high spot, just pop, 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 popping anything he could pop. And some people got better, some people didn't. BJ decided, hey, we need to narrow this down. We need to find out why some people are getting better and some people aren't. So in 1935, BJ started a research center. And he started off with just like what Dee Dee did, and was adjusting all the way down one side and all the way back down the other side, was pushing all the high spots. And he narrowed it down and did less and less and less, and he found his results got better and better and better. And when it was all done, and by the end of his 16 years of research of only the worst of the worst cases, he found that it was one of the top 2 bones in the body, the upper cervical spine, that was the cause of pretty much all of these ailments. So that was in 1951, by the time the research was finished. Well, during that time from 1893 to 1951, there was a lot of people who learned Dee Dee Palmer's process of adjusting up and down the spine, up and down the spine. Well, by 1951, when the upper cervical research came out, there had been a lot of other schools had popped up all over America that were teaching people how to adjust the entire spine. Well, B.J. Palmer did the upper cervical work, and then he later left the clinic and died in 1961. Well, that was only a 10-year span where upper cervical was taught at a full-time level out of his school. When B.J. passed, his son, David Palmer, then took over the college. Well, B.J. Palmer was known all over the world. He had been to the White House with 4 different presidents. He took care of Dr. Mayo and his family from the Mayo Clinic. He was world-renowned. Well, his son David had kind of lived in his shadows, so when BJ then passed, David Palmer came in and he removed everything that had BJ on it, removed all the upper cervical stuff, and went back to the full spine model, which is taught in most of the schools across the country today. So even as recently as 20 years ago, I would say there were a handful of upper cervical doctors. Now in the last 10, 12 years, there's been a real surge in growth and popularity in upper cervical, especially the last 4 or 5 years with the production now of documentaries on upper cervical, huge conferences. Now we've got postgraduate diplomat programs. So now the upper cervical work is really starting to pick up some momentum, which may be why you're hearing about it now because of web pages such as this.